but before him, there really wasn't anything like surgeons could do to...
Not really.
Really?
You want to know the first breast augmentation was?
Yeah.
Doc, do you know this? Hernandez? No, the first attempted breast aug.
Oh, attempted.
Yeah. They took a lipoma from a woman's leg and tried to put it in her breast. Just stuffed the lipoma in there, which is a fatty tumor.
Why?
They didn't know. They're like, oh, this thing is kind of big.
Plump. Let's just put it
Let's just stuff it in there.
Wow, that's so bad. And then doctors got the idea, oh, maybe...
They got these two guys in Houston got the idea of breast implants. Phillips knows. You know how Phillips, right? Yeah, they did it because they were squeezing a bag of blood.
Like a blood?
Like a blood bag, like looks like that.
Yeah.
Suck it all up and let it settle.
And they figured out, wow, I wonder if we can put saline in here and stick it in someone's breast.
Ooh.
I'm trying to get...
But not blood, I'm talking about.
Yeah.
They were just squeezing bags of blood. The show is called Breast Men.
Breast Men?
Yeah, it's a movie.
Okay. Wait, when did you say the first breast augmentation was? It was like 19
I think
what?
in the 80s. I'm trying to think it's in the 80s.
Wow, that's really neat.
Good history, right?
Yeah. Excuse me.
There's the inside of the face there. That's all muscle and fat.
Hi everybody, thanks for joining us. We're just getting started.
Beautiful avascular plane here, Doc.
On our second case of the day, our last case of the day. Hey there, Soul Ball. Do we get to see the procedure? Absolutely. So we're actually live on our YouTube right now. On our YouTube, we are able to flip the camera and show our surgeons, show our patients
You're done?
procedure.
Oh, you want to come over
If
here
you
and
want to
see?
join us over there, it's going to be Dr. Jeneby Plastic Surgery.
Yes.
There you'll be able to see the procedure, the surgeons.
So see how I lit the light? Show me where to go.
Let me know if you need help
Very
getting
important.
to
There's
our
like a thimble
YouTube
hook.
if you're interested.
Like you can put it on your thumb.
Again, for those of you on Dr. Bam's TikTok as well, you guys can join us at Dr. Jeneby Plastic Surgery and see the surgery live.
You really need your finger there.
I will be seeing Dr. Jeneby next Monday for a consultation.
Yay!
Hey, that's awesome. What are you considering getting done? If you'd like to share.
If you'd like to share.
If you'd like to share.
Yes.
Okay.
That's so sweet.
Again, for those of you just joining us, we are doing a
So instead of
facelift.
just doing a max lift,
We
each
are
time,
doing
look at
a
everybody's
upper
anatomy.
eyelid lift and a
She'd be better
low
with just
eyelid
little,
lift as
like,
well.
Smash lift like that. Do that. Or it'd be better this way.
We are also doing a neck lift today on our patient. She is doing 2 phases, so we're going to do her face, her neck, and her eyelids today. Then she's going to come back later, and we are going to do a tummy tuck with her as well. So stay tuned in the coming weeks. We will go live with her again, but we're just tackling that facelift, that neck lift, and the eyelid lift. So we are just getting started. Like I said, it's our last case of the day. Earlier we had a breast implant removal and replacement, so we just took out some old
With vaser, this is like butter.
some old implants. Our patient
Without vaser,
had actually had some implants in since 2006, and Dr. J was the one who did her first procedure, and she decided to come back with Dr. J to get a replacement. So that was very neat. We got a little video with her, so look for that on our profile. It should be out soon. But again, for those of you guys just joining us, we are live on our YouTube as well. So if you'd like to see the surgery and see the camera flipped, you can join us over there at Dr. Jeneby Plastic Surgery. I went ahead and pinned a form here on the bottom of your screen.
Forget about me all the time.
That's just if you're ready to take the next steps and booking your consultation, figuring out pricing, financing. If you're out of state, we also
I
do
just get some
like
to seal. We don't need the sprayer.
overnight for our patients that are out of state.
It's like a mid-face.
We can help you sort and figure
So you
out
can come like this.
a planning process for your surgery. We'll get you connected with somebody on our team who can help
So you lift up this way and you're pulling.
answer any questions that you may have. So in that form, it just takes a minute to fill out. It's really quick. It's really easy. Just ask for your information, like your full name, your email, what procedures you're interested in. And that just allows the people from our team to come prepared when they do reach out to you, equipped to answer any questions you may have.
Light way in the back there.
Wow. So, Val, oh, my consultation is already booked. That's awesome.
Hey, that's nice.
What procedures are you interested in? Again, we're on our last case of the day. Our patient that we're operating on right now, she is getting a facelift done. She is getting a lid lift, so eyelid like right here and her lower eyelid. We're gonna lift those, and then we're gonna do a neck lift with some fat grafting. And she's actually gonna come back to us in a few weeks, and we are gonna do a tummy tuck on her.
What suture?
We have the monitor.
So
We
right
have
now
over there
we're
the
just getting
monitor.
started on the facelift.
Oh, I have your book.
So we are on her right side, or excuse me, her left side of her face. And what we're doing is we're just kind of separating where the skin lays on the face. And we are just separating that as much as we can. And then we'll go in, remove some of the excess skin. And then what we'll do is we will pull that skin up to her hairline.
Also, we're gonna pull
Behind
the
the-
muscles. Hold this for me from on that side. Thank you. Keep your elbows in so you don't hurt it.
Sorry. Hey, Erica.
Oh, I am going to.
And
Uh-oh.
you're gonna what?
Wait a minute. Okay.
What Phillips is paid to do? Make you upset.
Do you want help? Okay.
They got it now.
Hey, Erica. What is your location? We are located in San Antonio, Texas. So we operate here at Maximus Surgery Center in Chrysalis. That's going to be Stone Oak. So that's northern San Antonio, if you're familiar.
Straight ones. For the suture. Thank you, senor.
Yeah, Erica. So we have a lot of patients who come from like cities that are like far away or even out of state. So if you're still interested in seeing what our process is like and like booking and setting up a consultation, you still can. If you fill out this form I have pinned on the bottom, once you do it, somebody from our team will reach out to you. We offer a lot of we offer accommodation, overnight, things like that. We can help with
Everybody
financing.
getting weird red lips? Not
Yeah,
just
if you want to go ahead and fill out that form, it's going to be pinned on the bottom here. Or it's going to be the get a quote button in our bio. Once you fill that out,
Did you do the Phillips?
I hit him.
It's crying.
I think he has something in his eye.
so let me know if
Paula,
that
did
works
it
for you if you're
work?
able to find it,
What did you do
Erica.
to Phillips?
It's going to be that get a quote button once you fill it
As you
out.
can see in the back. So I had to give him a papa and he
You
like,
know, spray some lidocaine in his eye or what?
shut up.
Hernandez.
Just seal in his eye. It's all shut.
It's one shot.
So when I was early resident, I was putting the nasal splint on a patient for an attending, and I squirted it, and I forgot. I squirted it so hard it went into her eye.
Oh.
Mastosol.
Mastosol?
Yep. In her
What the
cornea.
shot? Oh shit.
Well, suffice to say, my attending was a little upset for some reason. I learned now.
A
to
little?
push- Now I just crush outside the field and then bring it back in. And a lot of guys will do that. You'll watch people. You know, I'll correct them when I see it. I'll be like, you may wanna do that somewhere else.
You're like, I'm speaking for experience.
Yes.
Again, for those of y'all just
What do I know? What do I know?
What do you know?
What do I know?
We are doing a facelift today, a neck lift with back grafting, and a lid lift, so on the upper eyelid and the lower eyelid. We're just getting started on the facelift. If you guys would like to watch, you guys can join us on our YouTube. It's going to be Dr. Jeneby Plastic Surgery. Over there, we flip the camera and we show the surgery, we show our surgeons, and we show our patient and the procedures that we are doing. It's more interesting over there. Of course, if you have the stomach for it, it is going to show blood and some other things, of course. But over there, there's less restrictions when it comes to what we're allowed to show. Here on TikTok and on Instagram, we can only show ourselves. We can't show any blood or anything graphic, really.
Did you see it?
I got the Teceo, but I'm talking about the spray, the tubing spray and the stuff that you.
But we're not doing the tubing anymore.
No, but doesn't it come with the little things
little
too?
connector?
Yeah, that's
Yeah,
what
I put it on the table as well. No, I didn't throw it away. I dropped them both on the table.
Let me get out.
No, I need this.
Yes, sir. Drinking of all the available? Yes, sir.
I'll be there in 2 weeks for my mommy makeover. Excited and super nervous.
Me?
Yes.
Okay, well, there's other doctors here.
Well, it's on your live.
I didn't
That's
do the eyes
awesome,
yet, 'cause
MC
we're not gonna
Camper.
be on that for a long time.
You are in good
After
hands,
closing
of
one,
course.
I'll start injecting the eyes.
If you are going with Dr. J, he's been practicing for over 20 years, so
25, 20, let's see, 23.
23 years. So you are in good hands. Super excited and nervous. You have no reason to
with
be
it?
nervous, but I can see why you'd be super excited. Hey there, Erica. Please let me know how. I think you misspelled a word there. If you want to just revise it, how it will be, is that what you meant? Again, if you just fill out the form, once you put in all your information, somebody will reach out to you. Please let me know how it will be. So once we get off here, what I'll do is I will look at all the forms that were submitted and I send it to people on our team that will then later reach out to you. Oh, I see. So if you go on our TikTok, you just click the profile up here and you go on our TikTok. It's going to be the Get a Quote button. If you can't find it here on the page, it's going to be the Get a Quote button. It's the exact same thing. And then once you fill it out,
Like a Philly.
again, it's submitted, and then somebody from our team looks over it, and then they will reach out to you. So try that and let me know if that works, and then you can come back and we can kind of redirect you.
I mean, he had a huge
MC
sense of humor.
Campa, yes, with Dr. J. That's awesome. How long have you been waiting for your surgery at your mommy makeover?
You got all that, babe.
How long have you been
I mean,
wanting to get these procedures done?
You know.
Again, we are doing our last case of the day right now. We are with our last patient, and we are doing a facelift. So right now we're on the left side of her face, and Dr. J is with us. We also have Dr. Bam as well. And so what they've done is they've made an incision right here along her face and hairline.
And like, I wasn't
And they've
there
separated the
per se,
skin
but
from where it
oriented
lays
a little bit
flat
later.
on the face so that they can
Like,
hold
bro,
it and some of the
You grew up
muscle there
anachronistically. You should've been in
higher,
the
so it gives that
1900s.
lifted look, and then they'll
You could do
stitch
that
it
to
back
people.
here. Again, if you guys have any questions about that, comment those down below. That's what I'm here for, is to help answer.
Just took it, man.
Light over there.
MC Campa, 2
You got 20
years.
cc's.
Wow, good for you. Why so long? Hi
Yeah,
from
that's
Arlington.
20.
Hey there, Nathan. How are you doing today? Thanks for joining us. Everyone there
We're done.
on
We're
Dr.
done, okay?
Bam's. I just wanted to give y'all the
It's not,
opportunity to ask any
Slider, right?
questions
Not-
as
not
well.
Marcaine and-
No, no, it's
Engage
light
with some of our
2%.
surgeons
It's 10
here.
cc's of light over
Dr.
2%
Bam
NP and
isn't
10
in the
cc's
room
of
right
normal
now, but
We just didn't want to repeat
he
of
will be
last
back
week.
later.
Dr. Hernandez, like,
And for all of you watching, we're live on YouTube.
what the hell?
So,
What did you guys
on
do?
YouTube, we
Someone put
flip the
up there
camera
surgery
and we
test.
show the surgery, we show our surgeons,
Put
we
up there
show
that we had,
what's happening,
marking with that
the
because
procedures
they
that
have
are
light.
being done.
Oh.
So, again, you can
Wasn't
join
it
us
over
over
there?
there, Dr. Jeneby, plastic surgery. Hey Mona, what's going on here? Deep plane facelift.
It's not deep plane, you don't really, not everyone needs one. And it does stress the body a little bit because
Uh-huh.
more of a downtime and more injury to the facial nerve.
Uh-huh, okay. So is this like a,
Oh, okay.
I guess what would you call this, a normal facelift, or how would you
This is just called
categorize?
a max lift, like face of neck lift.
Alright, if you heard that, Mona, it is a max lift. So we are doing a
Minimal
facelift.
access cranial suspension, also known as max.
Max for short.
MACS.
So,
Yeah.
so we are doing a facelift. We're not doing a deep plane facelift. We're just doing a max facelift. And we're doing a neck lift. We're doing an eyelid lift as well. Hi from Kentucky. Thanks for joining us.
You okay, baby?
Yep. Did you have to go see a consult? Nope. You had one today. You have one or two today.
Yeah, this afternoon.
Irrigate.
A great question. There are, Dr. J also mentioned not everybody needs one, so that is also something to consider as well. There's different kinds of techniques, and when we do certain procedures, certain surgeries, it's not one fits all. But so that's a great question. And so if you're on our YouTube there, you can see Dr. J currently, he's still kind of separating where the skin would rest on the face and on that tissue and the muscles. And they will pull that skin and they will pull the muscles with it, and they will pull it back and then stitch it right along here around the hairline and a little, it kind of depends, like it can be behind the ear or above the ear. But again, if you're joining us on YouTube, you'll be able to see all of that instead of just listening to me explain it.
It's right there.
BC. Doesn't that look like him? Rick Ross?
Yeah, he is Rick Ross.
Hey Mona,
He's Rick
thank
Ross,
you. I
bro.
want to come see Dr. J. Well, thank you. Again, if you'd like to schedule a consultation and just have some of our team reach out to you, we can totally do that. We do virtual consultations, we do in-person consultations. It's kind of whatever is best for you. And you can just fill out that form that's on the bottom, that get a quote. That's the first step that we take. And once you fill that out, we're able to move forward.
Okay, let's see what we're gonna pull up.
Okay. Hey there, Nathan. On Dr. Bam's TikTok. Where are y'all's office at? Great question. So, Dr. Bam and Dr. Boom Boom Pow operate here at Maximus Surgery Center
Yeah.
and Chrysalis Cosmetic Surgery Center. So, that is located in San Antonio, Texas. And if you look on a map, Maximus and Chrysalis are right across the street from one another. So we just kind of run back and forth. We just kind of run back and forth between the two. But that's located in San Antonio, Texas. Again, that's San Antonio, Texas, Stone Oak area, if you're familiar. So that's northern San Antonio. Hey Steve, there on our YouTube. That form, great question. So when I'm referring to the form, when I say fill out this form, I'm referring to a form that is called our Get a Quote form that we're able to pin here on TikTok, but not on our YouTube. So if you're interested in filling out this form that I'm talking about, please join us at on our TikTok. It's going to be Dr. Boom Boom Pow. Once you click on our profile, you'll see in our bio the Get a Quote button, and you can fill it out that way. Let me know if that helps. Let me know if you understood. Well, it's also on our website there, Steve.
Okay, step on
It is also on our website, and that's going to be, if you just search up Dr. Jeneby Plastic Surgery, you should be able to find it. But again, if you can't find it, you could just come back here and we can help redirect you. Let me know if that helps, Steve. Super Mommy Makeover Price. Hey there, Gabrielle and Ida. So when it comes to pricing, it's not a one-fits-all. But in order to get a more accurate pricing and get a real estimate looking at real numbers, you can fill out this Get a Quote button. Somebody on our financing team and our sales team will reach out to you and kind of explain the numbers you be expecting to pay. I don't really know those numbers myself. And it just takes 1 minute to fill out, and somebody will hop on a phone call with you, they'll text you, email you, whatever, and they can provide all of that information. Not every patient gets the same things encompassed in like a mommy makeover, so that's usually why like pricing will differ, but also like it could be the patient's body and like how much lipo they are getting, or maybe we have to use certain techniques on them, so it's just not always a one fits all. But again, for more accurate pricing info, you can fill out the form, get a quote, and somebody from our team will look over that form and then reach out to you. It's really easy peasy. Hey, peg leg. How are you? And again, for those of y'all joining us, we are doing a facelift, we are doing a neck lift, and we are doing a lid lift. So for those of you on our YouTube, y'all are able to see this. And you can join us on YouTube if you'd like at Dr. Jeneby Plastic Surgery.
So you see that neck lift? First you anchor the jawline. Oh, do that now. Oh, I see toy. There you go, go this. We're gonna continue this up.
Good. Say hi to Docs. Hey. Peg leg says hi.
Peg leg! You haven't heard some peg leg in a long time. Peg leg was one of our first TikTok.
Really?
Yeah.
Good to know. Hey there, Jay. Are y'all in surgery? We are in surgery. We have Dr. Bam here, and we also have Dr. Boom Boom Pow. Yes, Yvonne, we are in surgery. So we are doing a neck lift on our patient. We are doing a facelift. We are also doing a lid lift. So we're gonna lift this, the upper eyelid and the lower lid. And she's actually gonna come back in a few weeks, and we are going to do a tummy tuck.
Yep.
It's a lot of surgeries to pair in one day. Obviously, we want to give her enough time to heal the first round, so that's why we broke it up into two. That's why we break it up into two phases, I guess you could say, two parts, if you will.
But they have to stay in the hospital.
And if you're on our YouTube there, you can join us, and you're able to see the surgery happening. You're able to see the procedure, the surgeons. How much is a mommy makeover? Yes, Jay. So it's not a one fits all. I'm not really well understood on the prices either. However, we do have our finance team.
Depends on your BMI too. We don't know. We have to see you. Depends on the time it's going to take us to do it.
Right.
The mommy makeover is going to have multiple procedures, so it'll be hard.
Right. There's a lot to consider and to prepare for. So I couldn't give you accurate pricing. However, if you just take 1 minute to fill out the form that's pinned here on the bottom, somebody from our team can give you those accurate numbers, the numbers you can expect to pay, and the numbers that you would look at. And not everybody gets the same thing in a mommy makeover. Like Dr. J mentioned, also we take into account your BMI, how long it would take, how much time we would have to spend in surgery. So take all of that into consideration as well. Of course, it's going to be, more than a couple $1,000s, but again, for a more accurate estimate, you can fill out that form that's pinned on the bottom. Somebody will reach out to you. You can ask those questions then. Yeah, Jay, thanks for asking. And if you have any more questions, feel free to leave them here. I'll answer those for you. Or we have Dr. J. If there's any questions you have about like pairing procedures and what common procedures people do have done at once, I can answer things like that pertaining to surgery more specifically.
Here we go again. Mouth is perfect. Oh yeah.
What are you doing right there?
So we put glue and we're holding it in the face glued, but with the glue.
Oh,
Like a
why?
Because it's glue being glued.
But what's
So,
being
like,
glued?
The skin's being glued back down with a glue.
Uh-huh.
He dissected the skin.
Yeah.
So I took the skin off, so I had to get it to go back down.
Okay.
You glue it.
Really?
Yes, with Conceal.
With
It helps
Conceal?
to seal.
Oh.
It also helps with bruising and swelling.
Okay.
We do a lot of things adjunctively here that most places don't do. Like we have our Cell Saver, we have Conceal, we have a Heme program. It's a good idea. I love it. And at least I think it gives them more options to operate on. All right, man, take a scissor. What do you want to cut? Where would you cut that? Right.
Hey Jay, how many procedures are in a mommy makeover? Yeah, so it's kind of up to our patient. We kind of just coined the term because patients usually like to do a one and done when it comes to surgery. They only want to go through surgery once, not have to break it up into multiple surgeries and kind of drag out the healing process. So it's kind of, usually it will consist of something done with the breast, so adding implants, doing a lift. It will also include, usually we have patients coming in to get a tummy tuck or a lipo 360, and then doing something with the butt. So BBL implants, that's usually what it consists of. That's usually what we see when people are inquiring about a mommy makeover or a super mommy makeover. And of course there's other add-ons that we do, like Renuvion or lipo to the axilla or an arm lift, you know, things like that. So it's kind of like up to you. We just kind of coined the term and include, when we see a lot of procedures like the BBL, breast, lipo 360, tummy tuck, we will kind of coin that as a mommy
12
makeover.
millimeters, right face. Left
Great
face.
question though.
I know. This doesn't like. This, I don't think we need one. Maybe if we do a 5 how fast.
No, that's, I would just,
Hey Sam, how are you?
with the suture, then you
When you
might
have a
give
suture.
Hey, how are you doing? Good to see you.
Yeah,
Put
yeah.
a little dot of them on.
Yep, little dot it, push it together. Okay, ready? Now let's get this one in.
So, this is kind of a silly question, but what were to happen if you didn't glue the skin down? I mean, like, it would just kind of sag or what?
Well, you want to help the skin to reattach
Yeah.
much, because one is going to prevent
Super tramp.
fluid or hematoma
Yep.
or seroma to form.
Okay.
If there's open space, there's going to be fluid.
Okay,
So,
I see.
Yep.
and then she'll have a better result too.
Uh-huh.
Because the skin is, attached back
Right now
together.
you'll see the drain, but that
Yeah.
goes away tomorrow. And
Oh.
that drains any of this fluid for a day.
Yeah.
That's another 60. Those two you gotta get down quick. Before it starts to slow. Deep. Okay. Yep. Yep.
Just thought I'd come in here and show you some love. I'm doing well 3-week post-op. That's awesome, Sam. I'm glad to hear that. I saw you had commented on one of our TikToks, the one where Dr. J's like clapping and then it cuts to that girl who's like doing her little cheer. I thought that was really funny. Yeah, you know what I'm talking about, right? That was a silly one. That was Abby's idea. It wasn't mine, so I can't take credit for it. Mana Spark, is the patient under anesthesia general? Yes, of course. She is.
We're gonna cut down here toward the mandible angle, like that.
I agree, Sam. I thought it was hilarious when I saw that. I didn't even know they were planning to do that, and then I saw it on the page, on my own, like on my personal TikTok, and I was like, oh, wow, that's funny.
Wide undermining, vaser first.
And again, for those of y'all just hopping on and joining us, we're on our last case. Right now, we're doing a facelift. We are doing a neck lift, and we're gonna go in and do an eyelid lift as well. I know he didn't even expect it or know it was coming. So.
I'm gonna cut this.
I'm gonna try to get over here. Hey Margaret, they're on Dr. Bam's TikTok. I lift how much? Yeah, great question. So it's gonna vary person to
3
person,
centimeters for neck.
depending on how long we expect to be in surgery with you. After we do our consultation, we're able to give you more accurate pricing information. I can't really disclose that kind of stuff. Also, I'm not very well informed either, but I can direct you to our sales team. I can direct you to our finance team. If you fill out this form here, the get a quote button, that's the first step that we take in giving you an accurate estimate. We need to calculate some other things, like determine how healthy you are. So if you want to fill that out, it takes 1 minute, and then somebody from our team reaches out to you, and they will provide you with that pricing information. Hope that helps. Let me know if you have any more questions. How long does the surgery take? Is the patient under general anesthesia? Yes. So yes, the patient is under general anesthesia. A procedure like this, since it is a facelift, a neck lift, and an eyelid lift, it's a lot more technical.
And here we're gonna have to come up a little bit, right? We're gonna have to extend this up to this dog here. Extend that up and you keep it upward. Stay along there.
So since these, all of these procedures are more technical than just getting like lipo 360 or something, they take much longer, and also it depends on
Be real conservative, so it just lays in.
the surgeon as well. Dr. J has been practicing for 23 years, so obviously with experience and skill, he's a lot faster than somebody who's only been practicing for a few years. But even still, these will take a few hours to complete.
I'm gonna give you a temporal excision.
But great question there, Mona Spark, on our YouTube. And thanks for joining us over there as well. And we're only on her left side right now. So we haven't even gone to the right side, and we've been here live. Oh, wow. We've been here live for about 30, almost 40 minutes. And we got started about the same time. So if you do the math, 40 minutes on one side can entail 40 minutes on the other side, and we still haven't gotten to the eyelids yet. So it does take a lot longer than like getting breasts done, and obviously it's on the face, so we want to take our time and make sure it looks beautiful.
So when we turn
great
the head, we're
question.
gonna start on the front.
Exactly, Sam. She is going to look beautiful. And she's going to come back in a few weeks, and we are going to do a tummy tuck with her. We wanted to break it up into 2 different surgery days, just because it is a lot to undergo in such a short amount of time. So that is why we're breaking it up. So in a few weeks, we're gonna go in and do her tummy tuck. So we're doing her face today, her neck today, her lids today, tummy tuck a few weeks later. Well, they're Mona, local, just local. It would be really.
Right here at the corner, right into there. Turn.
somebody asks, why can't this be done under local?
This nature?
That how could that be so? I got and look at the laugh dog. On Monday.
He always brings you
Like, man, you're so good looking. She becomes so damn good looking. Is that what they're asking? No?
Hey, Dr. J,
Yes.
somebody asked, why can't this be done under local?
You can, but then you have to pee sometimes. Can't let you get up to pee. If it's just 2 or 3 hours, you're gonna want to pee.
Wait,
How are you?
some people do it?
Yeah, they're awake.
No,
We
really?
just did a revision on Friday with Dr. Cornelius.
But if it's like an hour, it's fine. But 2.5 to 3, you're getting squirmy.
Oh,
You're starting to move too much. Some people
wow.
start talking too much.
They start trying to talk to you?
Yeah, and I'm like, stop talking.
That's funny.
And they're moving their face, and you can't see anything, and they're bleeding. Why would you want to do this awake? You have a beautiful anesthesia guy here. He's been doing it 30 years. Come on, lady. You know what I mean?
Yeah, I know what you mean. It wasn't me. It was for somebody else.
She's like, it wasn't me.
I wouldn't. Yeah, I don't know if I'd want to be awake. Wow.
We can. We'll do it for you, but
We don't
you have to
advise.
pee. You have to pee. You have to pee on yourself.
Oh gosh, yikes. That's not fun.
Yeah, that's under the not fun category. Thanks.
Yeah, Mona, so if you heard any of that, you can, but obviously it's not advised for
I mean,
many
depends on the
reasons.
person you are.
Yeah, if you think
Most
you
people
can.
think they can sit here for 2.5 hours, 3 hours without moving. But you know what? What we found?
What?
That ain't all true, baby.
Yeah, Mona, so if you caught any of that, looks like, you can, totally, it's up to you, but it kind of becomes a problem with you just getting squirmish and, again, like having to hold your pee and stuff like that, so, and just like awkwardness too, like you being awake while it's all happening,
Yeah, most people
Moving.
can't handle being awake.
yeah.
You think you can, you think you're badass.
But you have no idea.
You have no idea.
Girls go hand in hand. Oh, lap on the... 2 laps
But
on the floor.
I think that's a great question. So if you have any more like that, feel free to comment those down below. Oh my.
You're good now? The art dog. The artiste. Are you an artiste?
I'm gonna hop on this side. Wow, that's really interesting.
Now we're basically taking the skin off of the muscle.
Yeah.
With this device. It also has a great byproduct of being hot, so it helps to shrink the skin.
Wow.
Yep.
Very interesting. Okay, Dr. J, have you ever had to use the restroom during surgery?
All the time. You wait like a normal person. But the problem is when we put you under, we do it awake, we still give you a little sedation. And then you're kind of like, you don't care. And you start asking me crazy questions. Like, you come back. Or you start talking to me. I'm like, can you stop moving your mouth because I'm around your nerves.
Good to know.
You got everybody on your
Everybody's saying, All right, Doc, forehead was 1 minute.
So the answer was
Face.
yes. But of course,
1 minute. Neck will
they
be
have to
another
wait.
minute.
I don't know if you caught all of that. I can see it's kind of glitchy over here on our TikTok. It might just be because this phone has been on for so long. But let me know if the quality is okay. And again, for those just joining us, we're doing a facelift, neck lift, and lid lift. So the eyelids here, we're going to lift those and the under eyelids as well. And we are now on her right side, the right side of her face. And so what Dr. J is doing is he's using a tool. It's a really hot tool to help separate the skin from basically all that tissue that the skin rests on, all the muscles there. And because it's so hot, inadvertently it tightens the skin. So that's neat. For anyone who wanted to know that or didn't know that, now you do.
Now you do. You're good?
And so why he does that is because we need to not remove, but separate the skin from where it rests on the face so that we can take that skin, we can take the tissue, the muscles, and pull it up and then stitch it up here. And that's how we get that lifted look. Again, if you guys have any questions about that, what it looks like, go ahead and comment those down below. And then you can also join us on our YouTube. On our YouTube, what happens there is we show the surgery itself, we show the surgeon, we show the patient, and we are just able to do more on our YouTube. Here on TikTok and on Instagram, we don't show the surgery just because the guidelines are more strict with what we can show. So let me try to get a better positioning.
You do our bidding? Do our bidding?
And again, this is our last case of the day. So this is our last live. And then we're gonna call it a day.
Oh, wait, no.
We'll be live later this week.
Nip top.
Earlier this morning, we had a case, and what we did there was we did a breast implant removal, and then we did a replacement, so adding new implants. And our patient actually got implants removed that Dr. J had put in 2006. So very interesting case. We had a returning patient, which is very interesting, very neat. Again, 2006, that's almost 20 years ago. So that was pretty interesting for me to see, for Dr. J even. So thought I would share that with y'all. Smile face. Hey Mona, is this a SMAS facelift?
So you taught us all?
So, hey, great question. So, Mona, what is some hand with the orange cap doing to her face? Great question. So, we were just on her left side, and what we were doing was we were, as you can see what Dr. J is doing right now, we were doing that on her left side. And so what Dr. Phillips there, at Dr. Bam, is doing is stitching it back up. So he's stitching it along her hairline and behind her ear to give the face lift. So let me know if you caught that. Oh boy.
What do you think of that? Antenna.
Yeah, it's interesting.
Pretty interesting, right?
Yeah, it's
Basically,
really,
I'm taking the skin off of the muscle.
yeah.
See, that's what he's saying when he's separating the skin.
Uh-huh.
He wants to glue it back together.
Yeah. What do you guys,
Glue it back.
I mean, how does that work? How, well, I'm just concerned. I'm not concerned, but like curious, like, is it, I mean, I'm sure it's safe, but like, what do you guys use?
It's superficial, so he's dissecting.
Superficial, so the muscle or the nerves are under this plane.
Yeah.
In the parotid.
Uh-huh.
As long as I stay superficial, we're good.
Okay.
So he's saying
Yeah.
skin, when he's separating, because if he doesn't detach the skin from the muscle, then how is he going to be able to,
Right. Pull it, yeah.
you know what I mean?
Good over there now?
Uh-huh.
Home run, you're on the home stretch. I have to push a little bit more there. Turning the head up. Everything good?
So when people first started doing facelifts, did they not glue and they were trying to, or have they always glued or what?
Blue,
Like the,
the silk came out probably in the late 90s, early 2000s, I think.
uh-huh.
Man. Yeah, I'm gonna get you out, you can have your attic, that's showing me off. I'm kind of gonna put it out.
What did you end up taking on Friday? You were going on a date.
We went to Wildfish. Double Hook.
Oh, okay.
And we got
Alright
the
guys,
Parmesan
so
custard
again,
sole,
we are
which is,
doing a
probably the
facelift, neck
best
lift,
fish in the city. So they
lid
take this
lift
Silver sole knife.
on our patient
They take the
today.
silver sole,
We've been live here for almost an hour. It's gone by really
panko
quick.
and, Parmesan,
For those of you who have stayed with us for
or bacon.
a long time, thank you. Thank you for joining us. And thank you for staying
80
tuned.
beats.
We're gonna take a break here pretty soon. I have to use the restroom, so I'm gonna take a break pretty soon. I'll be live here for just a few more minutes,
What is it?
and we may or may not come back to finish off the surgery because it is a longer one, so it takes a little bit longer than all of the other procedures that we do here. Since it's 3 big technical surgeries in one, it does take longer.
Maybe bacon.
Bye, Sam. Thanks for joining us. Good to hear from you, like always.
Alexa, turn it up.
And again, if any of y'all are ready to take the next steps, of course we have the get a quote button in our bio, but we also have the form pinned on the bottom. Fill it out. Takes 1 minute. Somebody from our team will reach out to you. Then we can set up your consultation. We are able to move forward. Ask any questions you would like. We would be able to answer things about financing, getting you an accurate estimate, things like that. Yeah, and Butler, where are you located? Great question. We're located in San Antonio, Texas. The Alamo City, as we like to call it. So we operate here at Maximus Surgery Center and Crystal is Cosmetic Surgery Center, and we are in the Stone Oak location. So that's North San Antonio, Northern San Antonio. So take that into consideration. If you are from another city, out of state, we offer a lot of great options when it comes to accommodation, helping you get situated here, why you should come here. We make that process really easy and smooth for you. So again, fill out that form. If you're interested, it's here on the bottom. It takes 1 minute. Somebody will reach back out to you, asking you questions with all the information that you provided. So anyway, we may or may not go live again later today, but we are going to take a break. We've been live for about an hour now, so y'all should give us a follow. It'll notify you anytime that we do go live, so that way you don't miss out. And thank you for all of those who did join.